communicates during and off handoff shift by observing the 5 Ps. Effective communication is a reciprocal interaction.
Morning! Kamusta? Okay naman. Well, at least nakapagpahinga ako sa video yung matuloy. Ako, mabuti naman din. Ito, ganun pa din. Toxic ba? Toxic? Hindi masyado. Okay. Okay. Siguro, let's start with the prayer muna. In the name of the Father, the Son, and the Holy Spirit. Amen. So again, good morning, Super Nurse JM. Handing off patient Saddam Ander, born on December 2, 1962, a 49 years old, American male, and under the service of Dr. Gutierrez. So, bago patient tawag, ano nangyari sa kanya? Well, yes, na-admit siya sa ER with a chief complaint of severe headache, rated 10/10, vomiting, and loss of consciousness. He is initially diagnosed with an increased ICP related to head injury resulting from fall. He regained consciousness prior to admission sa unit natin. He has also a history of hypertension and can understand Filipino a little.
So, anong plan for our patient?
Ang patient is for further observation pa. Plan of care, well, involves management of increased ICP at nung hypertension niya to promote adequate cerebral tissue perfusion, comfort, and safety also.
Okay. So, kamusta siya during your shift kanina?
Kanina, alert and oriented naman siya to time, person, and place pagising. Pero halos tulog siya buong shift ko. Nung 10:30 PM, nagreklamo siya na masakit yung ulo niya, rated 8/10. After ko mabigay yung medication, PRN, pain medication niya, tuloy-tuloy na rin yung tulog niya. Then, latest BP niya is 130/90. Hindi naman siya sumukat, saka hindi naman siya nawalan ng malay.
Okay. So, may mga precautions ba for this patient?
Yes, patient has a high risk for falls.
And may deadline procedure ba sa kanya for today?
As of now, wala pang new order for any procedure eh.
Mga medicines na ba siya?
Okay. Ito yung mga meds niya. Ito. Tapos, ito yung mga PRN meds niya. Okay na?
Sige. Lastly, may mga ibang parameters pa ba na kailangan?
Yes. Upon my assessment, pupils are both 2 to 3 diameter, equally round and reactive to light accommodation naman. Tapos, well, patient is alert and awake, so GCS sa akin, 15.
Okay. So, sige. Salamat, Marlon, ha?
Okay.
Ingat ka.
A super nurse establishes rapport and trust as well as connect with the patients.
Good morning, ma'am. Good morning, sir. My name is JM, and I will be your nurse for this shift. I will be starting from 6 o'clock in the morning until 2 o'clock in the afternoon. So, how was your day? How was your sleep?
Good morning.
Good morning. I feel a little bit refreshed. I had a headache last night though, but after I was taking my pain medication, I slept all throughout the night. Thank you for asking, by the way. How about you?
Well, that's good to hear. I'm doing great. I came from a 3-day off, so I guess I got good amount.
A super nurse identifies patients correctly and always checks for personal identifiers.
So, right now, sir, for your safety, can I hold your hand as I check your ID bag?
Sure.
Thank you. And can you please state your name and your birthday for me, please?
Saddam Ander, December 2, 1962.
Thank you for that, Mr. Ander.
A super nurse assesses his or her patient for level of consciousness and pain upon initial contact.
So now what I'll be doing is to assess your motor response. Is that okay?
Okay.
Okay. Can you please first raise both of your arms?
Sure.
Thank you. And now, can you please raise both of your feet? Thank you so much.
A super nurse also includes proper skin and nutrition assessment. Any changes in skin characteristics or appearance must be duly noted, for this might lead to decubitus ulcer formation, or commonly known as bed sores.
And the next thing I will do is to perform a pupillary assessment. I will dim the lights first, and then I have a tool here with me. It is a pen light. What I'll be doing is to move this pen light from the side of your eyes going to your eye. All you have to do is to just look at the ceiling and stare at it, okay?
Alright.
Can you look up here? Well, your pupils look normal to me.
That sounds good to me.
Now, are you experiencing any discomfort or pain?
No headache or any discomfort as of the moment.
A super nurse changes the position of the patient on bed appropriately in response to patient's condition.
A super nurse reduces the risk of patient harm resulting from fall.
And now, for your safety, sir, I would like to ask for your permission to have this items up. Is that okay with you?
That's fine with me.
Okay. And is there anything else, any issues or concerns that you would like to be addressed?
Nana.
Okay. If you need something else, just press the call bell and I will be glad to assist you.
Thank you, JM.
Salamat, nurse.
My pleasure.
A super nurse communicates therapeutically throughout the nurse-patient relationship.
Nurse, tulungan mo asawa ko!
Ano po nangyari? What happened to Sir Andrew?
I can't feel my legs! I can't move them anymore! Why is this happening? Why can't I move them? Am I gonna die? They were perfectly fine a while ago!
I know that this must be hard for you, sir, but I need you to calm down so I can accurately assess you and refer you to the doctor.
How can I become a son like this? How can I become a son like this?
Sir, I understand how are you feeling right now, but please try to cooperate with me. I want you to be calm, so please try to inhale through your nose and exhale slowly through your mouth. This will help you calm down. Just do it. Just inhale through your nose and then exhale through your mouth. You're doing it right, Mr. Andrew. You're doing it right.
A super nurse thinks critically always in addition to applying the nursing process.
I need to ask you a few questions while I try to assess your condition, Sir Andrew. So first, I will be checking on the condition or the appearance of your lower extremity. Your bed is wet. Did you feel like you were boiling already?
I peed on my bed! I didn't feel it! Is that bad? What's happening to
Calm
me?
down, Mr. Andrew, calm down. That is what I am going to find out right now. So next, I will be trying to check and touch the lower extremity so I can assess which part is affected, okay? Can you feel this?
No.
How about this?
Nope.
And this one?
Nope.
How about this?
No.
Now is I will be pinching the nail of your bed, and then I'll be starting with the right toe, and then on the left toe. Can you feel this?
No.
How about this? So, Mr. Andrew, when did you notice that you cannot feel them?
I can't remember. Just before we called you, I guess.
Is there any other pain or discomfort that you're experiencing besides this?
None! Just my legs! How many times will I tell you that?
Mr. Andrew,
Just get out of here and go to the doctor!
Mr. Andrew, I understand where you're coming from, but all these informations are necessary for me to effectively communicate what's happening with you to your physician. So please try to cooperate with me, okay?
Okay, just hurry up.
So what I'll do now is to get your vital signs and then and then I will notify Dr. Gutierrez right away about what happened and my assessment finding regarding your condition so we can assess you further. For the meantime, I want you to please stay calm and just stay put on bed. Mrs. Anger, I want you to be calm as well and just stay with your husband and just try to be strong for him. And for the meantime, I'll just go ahead and notify Dr. Gutierrez, and then I will just call the nursing aide to change the bed unit for you, okay?
Sige, nurse, pakibilis na lang.
Sige po. Kung may kailangan po kayo, paki-press na lang po yung call button, then pupunta po ako kagad.
A super nurse performs a fall risk reassessment if a change in patient's condition or status occurs. Previous measures are then evaluated, improved, and then implemented so as to reduce fall risks.
A super nurse effectively communicates any recent changes in the condition of the patient to the other members of the healthcare team using the important.
Good morning po, Doc. Ako po si Jay at bedside nurse ni patient Adam Andler. Pwede ko po ba kayo makausap ng sandali?
Good morning, Nurse JM. Bakit? Anong nangyari sa kanya?
Well, kasi po, kakagaling ko lang po sa room niya kanina. Then, nag-complain po siya ng hindi niya po maramdaman at hindi niya magalaw yung mga paa niya. Tapos, naihi po siya sa bed niya na hindi niya namamalayan. So, ngayon, after na nagpanic po siya, tsaka iyak na patient.
So, please nurse, pakikuha naman yung chart niya and then mag-utos ka.
Sige.
Nurse, ano nga palang background ng patient ito?
Okay. Bali po, my patient is Adam Andler, 49-year-old American male. He was admitted to the emergency room 3 days ago with a chief complaint of severe headache rated 10/10. It was also accompanied by vomiting and loss of consciousness. Yung initial diagnosis po was increased intracranial pressure related to fall resulting from head injury. So, he regained consciousness upon admission to our unit 3 days ago. So, ano po, last episode po of headache was last night rated 8/10. And wala po episode of vomiting and loss of consciousness.
So, what have we done so far?
Well, kanina po, pinakalma ko yung patient and then assessed him GCS 15 with lower extremities paralysis. He can't move and feel both of his legs, even I elicited pain. The lower extremities looks well perfused naman po. Peripheral pulses was noted or is present and capillary refill within 2 seconds. And then urinary incontinence was noted kanina since napansin ko po na basa yung bed niya. And then wala naman po daw any other pain or discomfort na nararamdaman yung patient aside doon. And yung latest BP niya po was 130/90, heart rate is 98, and respiratory 20 with temperature of 37.3. I would recommend, Doc, that you evaluate or you reassess the patient as soon as possible.
Okay, sige nurse. Thank you for that information.
Well, it looks like everything is ready for you at home, Mr. Andler, and I'm very glad that you are feeling better right now. I hope that you fully understood all the instructions that were provided to you, and that you try to follow them and comply to them as strictly as possible. So is there any other else that you want to clarify or any questions? Yeah, Mr. Andler.
Thank you, Nurse Chia.
It is my utmost pleasure, sir.
You don't need to be a superhero to save lives.
You don't need to be the man of steel who wears a cape and flies.
You can be a hero in blue or white, doing good, making a difference, and leaving a legacy with all your might.